Professor Michael Kidd from the University of Toronto is also the director of the World Health Organization Collaborating Center for Family Medicine and Primary Health Care. Welcome.
Thank you.
All through the RC, we've been listening to whether primary health care is taking precedent or tertiary care. And we're seeing a lot of countries in our part of the world moving towards tertiary care. They think it's the best, whereas primary health care is the need. Among the countries you've visited, where do you think is the best example for primary health care?
Well, for me, I think the best example is probably Brazil. Brazil has this wonderful system of family health teams, of a family doctor working with a family doctor trainee, working with 2 nurses, working with 6 community health workers, all as a team, and looking after a very defined geographic population. Every house in a defined area, they're responsible for going and visiting everybody who lives there.
And they have the services for it?
They do. And in using this model, you can look after a population of 3,000 to 5,000 people and provide comprehensive family medicine, comprehensive primary health care to that entire community.
Even non-communicable diseases are also part of it?
Certainly. It's comprehensive care. So it's acute conditions, non-communicable diseases, mental health, health from the beginning of life to the very end of life.
You've given us a very good example of Brazil. My question would be, if some countries would learn from that, it would be a good experience, of course, but the cost implications, if you were cost benefit of building so many centers versus a huge tertiary sophisticated center, where are the benefits?
The evidence is really clear. Those countries who invest the most in primary care have lower healthcare costs, have more equitable healthcare outcomes, and are able to look after the entire population. So this is true universal health coverage. Those countries which invest largely in hospitals often are only looking after a very crust of their community. Most people are not receiving the care that they need.
I have another question for you, is that you have had a review of the status in Saudi Arabia, the condition of primary health care there. What were your, what did you come out with?
Well, I think Saudi Arabia is one of the countries in this region which is doing a wonderful job. They've got a very strong focus on building primary health care using the family practice approach. And they have a national strategy on primary health care, and they're rolling it out. They're training up their workforce. They're making sure they've got specialist family doctors with postgraduate education and training, and then with support beyond that. They're making sure the rest of the workforce is well trained as well, the nurses, the pharmacists, the dentists, the other people, and everybody is working together as a team. They've built a system of primary health care clinics across the country, and the care is integrated. And it's also integrated with other specialists, and it's integrated with the hospitals, because primary care doesn't stand on its own. Primary care has to be integrated with the rest of the healthcare system. It's a whole healthcare system, and primary healthcare is sitting there in the center.
So they're well on their way.
I think Saudi Arabia is doing very well, but there are many countries in this region which are doing well as well.
Thank you very much, Professor Kidd. It's been
a
pleasure.
Thank you.
Health for all, by all, go primary health care.
Absolutely.